Many seniors in the United States are quietly battling daily struggles with memory, mood swings, anxiety, and a gradual decline in cognitive sharpness. Words like just getting older or normal aging are thrown around too easily, downplaying a very real and growing issue that affects millions in the United States, Canada, United Kingdom, and Australia. What's worse is that many of them don't even realize that specific vitamin deficiencies could be playing a massive role in their mental and brain health decline. And it's heartbreaking because these are issues that could be improved, slowed, or sometimes even reversed if the correct nutritional support was in place. Every senior deserves the clarity of mind to remember the names of their grandchildren, to feel emotionally stable, to maintain independence longer. Yet, far too many are being misdiagnosed, placed on medications that only mask symptoms, and completely missing the key nutrients that their aging brains are starving for. The system in the United States is heavily focused on pharmaceutical interventions, and while those may help temporarily, they rarely solve the root of the issue: cellular nutrition and brain chemistry. The first critical vitamin that seniors must be aware of is vitamin B12. A deficiency in B12 is extremely common in older adults, particularly in the United States, where processed foods dominate many seniors' diets and absorption naturally declines with age. B12 is essential for the formation of red blood cells and the maintenance of a healthy nervous system, and without it, the brain begins to suffer. What's truly alarming is that B12 deficiency can mimic symptoms of dementia. Memory loss, confusion, difficulty concentrating, irritability, even hallucinations. These symptoms can be terrifying and often lead doctors to suspect Alzheimer's or depression. But what if it's just a deficiency? In the United Kingdom, one study showed that nearly 20% of adults over 65 had low or borderline B12 levels, often undiagnosed. In the United States, it's worse because routine B12 testing isn't a standard part of senior care. Many are left deteriorating, sometimes institutionalized, when all they needed was a regular B12 injection or sublingual supplement. And the emotional impact of this? Watching someone lose their identity, their past, their sense of purpose, is devastating for families. B12 isn't just about preventing memory loss. It also supports the production of neurotransmitters, like serotonin, and dopamine, which directly affect mood. Seniors struggling with depression, especially in Canada where long winters and isolation can take a toll, might simply be lacking B12. And if they're also on common medications like metformin for diabetes or proton pump inhibitors for acid reflux, both widely used in the United States and Australia, their risk of B12 deficiency skyrockets because these drugs interfere with B12 absorption. It's not just about taking a supplement randomly. It's about understanding the bioavailability and the form. Methylcobalamin is the preferred form for brain health, as it crosses the blood-brain barrier more effectively than cyanocobalamin. Seniors need access to this information, and it's not being given to them because the healthcare system prioritizes symptom management over nutritional healing. How many more families have to watch their loved ones slip away mentally before this becomes a priority? The next essential vitamin is vitamin D, often called the sunshine vitamin. But for many seniors, especially those living in colder climates like Canada or the northern United States, regular sun exposure just isn't happening. Low vitamin D levels are now directly linked to an increased risk of depression, cognitive impairment, and even dementia. In fact, one large-scale study from the United Kingdom found that individuals with low vitamin D had a 53% increased risk of developing Alzheimer's. And this isn't rare. Over 60% of seniors in the United States are believed to be vitamin D deficient, particularly in winter months. That's more than half of our older population walking around with a brain that's struggling simply because of a lack of one critical nutrient. And when you think about it, how often do seniors actually get outdoors? Many are in assisted living or nursing homes where time outside is minimal, and when they do go out, they're told to wear sunscreen, which further blocks vitamin D production. The system is failing to address this basic need, and the consequences are profound. Vitamin D plays a crucial role in reducing inflammation in the brain, and chronic inflammation is one of the major contributors to neurodegenerative disease. This isn't just about bones or immune function. This is about preserving identity, memories, personality. Low vitamin D is linked with increased brain atrophy, which means the brain physically shrinks faster when this vitamin is missing. And, again, medications interfere. Seniors taking statins, anti-seizure medications, or corticosteroids may have even lower levels of vitamin D, further compounding the problem. And the emotional burden that comes with cognitive decline, confusion, fear, loss of independence, cannot be underestimated. Some seniors in Australia report feeling like prisoners in their own minds, knowing something is slipping, but not being able to stop it. The frustration, the helplessness, it's cruel. All while there are studies confirming that supplementation with adequate vitamin D, especially D3, can significantly slow cognitive decline and stabilize mood. Equally important is vitamin E, particularly in its lesser-known but more powerful form, tocotrienols. Most people in the United States think of vitamin E as alpha-tocopherol, which is the common form in most multivitamins, but that form can actually be counterproductive in isolation. Tocotrienols, on the other hand, have shown promising results in protecting the brain against oxidative stress, which is a huge factor in age-related cognitive decline. Oxidative stress damages brain cells, and in aging brains, this damage adds up fast. Studies out of the United Kingdom and Australia have shown that tocotrienols are neuroprotective, supporting the brain's structure and function by preventing lipid peroxidation, preserving mitochondrial function, and even reducing amyloid plaque buildup, the same plaques found in the brains of Alzheimer's patients. How is it possible that this information isn't widely shared with seniors? Why are the shelves in most pharmacies in the United States filled with the wrong form of vitamin E? This isn't just a nutritional oversight. It's a systemic failure in educating the public on what really supports mental longevity. The emotional cost of brain degeneration is catastrophic. Seniors lose their sense of self, their families lose connection, and the healthcare system becomes a revolving door of hospital visits, medication adjustments, and memory care placements. Vitamin E tocotrienols don't just protect the brain. They actively support regeneration and repair. In one clinical trial, seniors who supplemented with tocotrienols for 18 months showed a noticeable reduction in brain white matter lesions, which are commonly associated with stroke and vascular dementia. And yet, when was the last time a doctor, in the United States, Canada, or even the United Kingdom, recommended tocotrienols to a patient showing early signs of memory loss or confusion? It almost never happens because the supplement industry, heavily influenced by pharmaceutical giants, pushes only what's profitable and easy to manufacture. Tocotrienols are harder to source, more expensive, and less known, but they are incredibly powerful. Seniors deserve access to what truly works, not what's convenient for the industry. Another deeply underrated vitamin when it comes to brain and mental health is vitamin B6. In the United States, many seniors are eating diets that are too low in B6 because of processed food consumption and reduced appetite. B6 is absolutely essential for synthesizing neurotransmitters like GABA, dopamine, and serotonin, chemicals that regulate mood, focus, and sleep. When levels of B6 are low, symptoms such as irritability, depression, brain fog, and even panic attacks can appear. This is especially relevant for seniors who already face emotional challenges from retirement, loss of loved ones, and decreased social interaction. In Canada and the United Kingdom, there's growing awareness about the importance of B6 for mental health. But in the United States, many seniors are never even told their mood disorders could be related to a simple nutrient deficiency. They're given antidepressants instead, often without any nutritional testing. The reality is that without B6, the body cannot convert tryptophan into serotonin. That one chemical reaction can make the difference between a senior feeling stable and emotionally connected versus feeling numb, anxious, or hopeless. There are thousands of seniors across the United States, from Arizona to Michigan to New York, who are suffering needlessly when a B6 supplement, especially in its active form, pyridoxal 5-phosphate, could change everything. B6 also helps regulate homocysteine levels in the blood, which, when elevated, is a risk factor for stroke, dementia, and heart disease. Again, this isn't just about mental health. This is whole brain, whole body protection. And the heartbreak that comes from watching someone you love spiral into confusion and emotional detachment is a weight that families shouldn't have to carry if it's preventable through simple, affordable intervention. Another absolutely essential vitamin that continues to be overlooked in the brain and mental health conversation for seniors is folate, also known as vitamin B9. In the United States, despite folic acid being added to many grain products, seniors often still fall short in getting the biologically active form of folate that their brains need. Aging impairs the body's ability to convert folic acid into its active form, L-methylfolate, which is the only form that can cross the blood-brain barrier and be used in neurotransmitter synthesis. This matters because folate is directly involved in producing serotonin, dopamine, and norepinephrine, all of which impact mood, cognition, energy levels, and even sleep patterns. In a country like the United States, where depression among seniors is frequently treated with SSRIs, it is disturbing to realize that many of these individuals are severely deficient in folate, and their medications aren't fully working because the brain lacks the raw material to make these neurotransmitters in the first place. And what's even more frustrating is that this deficiency is almost never tested. Doctors will often dismiss symptoms like low mood, fatigue, poor memory, and slow thinking as part of normal aging, without checking folate levels or investigating whether the patient can properly convert folic acid. In the United Kingdom, new studies have shown that supplementing with L-methylfolate has improved cognitive function in elderly patients and significantly improved treatment response in seniors with treatment-resistant depression. Similar results are being echoed in Canada and Australia, where more progressive healthcare providers are looking into nutritional psychiatry as a real intervention. This form of folate also helps regulate homocysteine levels, which, when elevated, are linked not just to stroke and dementia, but also to brain shrinkage. Yet, seniors in the United States are often unaware of this because the healthcare system does not prioritize nutritional status, and many insurance providers don't cover advanced micronutrient testing unless severe symptoms are present. There are real stories of seniors whose lives were changed by simply identifying and correcting a folate deficiency. One man in California, struggling with daily confusion and mood instability, was believed to have early Alzheimer's. But after working with a specialist who measured methylation function and homocysteine, he was placed on L-methylfolate. Within months, his mental clarity improved. He started sleeping through the night and even began reading again, something he hadn't done in years. These are not rare miracles. These are biochemically sound responses to giving the brain what it needs. Yet, the emotional pain of families across the United States watching their loved ones decline without hope is ongoing, simply because of missing knowledge and poor clinical practices. How many lives could be restored if folate testing and supplementation were prioritized? Another vitamin that plays a central role in mental wellness and cognitive stability in older adults is vitamin C. In the United States, where fruit and vegetable consumption tends to decline with age and appetite changes, vitamin C deficiency in seniors is more common than most people think. The body doesn't store vitamin C for long, so daily intake is crucial. Vitamin C is a powerful antioxidant, but more than that, it's required for the synthesis of neurotransmitters like dopamine, noradrenaline, and serotonin. It also reduces oxidative stress and inflammation in the brain, two major drivers of neurodegeneration. A brain exposed to years of oxidative damage without sufficient antioxidant defense becomes a breeding ground for memory loss, cognitive dysfunction, and depression. Vitamin C also helps regenerate other key antioxidants in the brain, like glutathione and vitamin E, making it an indirect yet crucial partner in protecting neural integrity. Seniors with low vitamin C levels often experience symptoms like fatigue, apathy, irritability, and cognitive fog, which are easily mistaken for signs of aging or early dementia. In reality, they might just need more fresh produce or a high-quality supplement. In countries like Canada and Australia, where older adults often rely on government-funded senior care meals that may lack sufficient fresh fruits and vegetables, the risk is even higher. And in the United States, the reliance on packaged and processed foods in assisted living homes means the problem is widespread and often invisible. The emotional toll of vitamin C deficiency is also profound. Seniors who are isolated, already struggling with depression, and begin to lose their sense of joy or connection to the world may just be malnourished. A senior in New York reported feeling lost in a fog for months until a nutritionist advised daily high-dose vitamin C. The clarity that followed within 2 weeks shocked both him and his caregivers. This isn't just about fighting colds or boosting the immune system, this is mental survival. Yet it's rarely included in routine care plans for seniors in the United States or even the United Kingdom unless scurvy-level symptoms appear. That is medical negligence disguised as protocol. A lesser-known but extremely powerful nutrient for brain health is choline, particularly in the form of citicoline or alpha-GPC. Choline is a precursor to acetylcholine, the neurotransmitter responsible for memory, attention, and learning. Without enough choline, brain function slows down dramatically, and this deficiency has been strongly linked to Alzheimer's and other dementias. In fact, brain scans of patients with memory issues often show signs of reduced acetylcholine activity. Citicoline supplementation has been shown to improve cognitive performance in elderly adults, and in one study from the United Kingdom, seniors taking 500 milliliters per day for 12 weeks demonstrated significantly better memory recall and attention compared to the placebo group. In the United States, choline is still not classified as an essential nutrient in many health plans, and as a result, most multivitamins leave it out or included in completely ineffective dosages. Dietary sources of choline like eggs, liver, and fish are often avoided by seniors due to outdated cholesterol fears or digestive issues, especially among populations in Australia and Canada. But the brain can't function without it. Acetylcholine also regulates REM sleep and muscle activation, which is why seniors low in choline often complain of insomnia, muscle weakness, and dreamless sleep. A woman in Illinois suffering from forgetfulness and disorientation was put on memory meds that made her feel numb. Only after being introduced to citicoline by a health coach did her symptoms begin to reverse. Within a month, her family reported a stunning return of energy, memory, and even creativity. That's the power of feeding the brain what it actually needs, not just medicating the symptoms. This is why the conversation around senior brain health cannot be dominated by pharmaceuticals alone. Omega-3 fatty acids, particularly DHA, docosahexaenoic acid, although not a vitamin, must be mentioned because of their absolutely essential role in maintaining the structural integrity of the brain. Nearly 60% of the brain is made up of fat, and DHA is the dominant component in the brain's gray matter and retina. In the United States, fish oil is often marketed for heart health. But what many seniors don't realize is that their shrinking memory, increased confusion, and slow reaction time might be connected to DHA deficiency. DHA is anti-inflammatory and supports synaptic plasticity, which is the brain's ability to adapt, form new connections, and recover from injury. In seniors, especially those with a history of heart disease or metabolic issues, DHA levels are often critically low. The average American diet provides less than 1/3 of the recommended DHA for optimal brain health. And in the United Kingdom and Canada, similar patterns emerge in aging populations. Supplementing with at least 1,000 babitinaru of combined DHA and EPA daily has been shown to significantly slow brain atrophy, improve verbal fluency, and reduce depressive symptoms. This is especially critical for seniors showing early signs of Alzheimer's or vascular dementia. And the emotional relief families feel when their loved ones become more present, more connected, more themselves again. There are no words for that. The tragic irony is that all of these nutrients are accessible, affordable, and backed by science. Yet most seniors never hear about them because their primary care visits are rushed. Lab work is limited, and nutrition is still not integrated into conventional medical training in the United States. Even when they ask about supplements, they're told, just eat a balanced diet, despite the fact that many seniors face poor digestion, medication interactions, or simply don't eat enough. It's not enough to say, eat healthy, when the body is no longer absorbing like it used. 2. Seniors need targeted therapeutic doses of the right forms of nutrients. The system has to catch up with the science.